Hi, Kevin Henry with Dental Economics and Dental Assisting Digest. I'm here today on Skype talking to my friend Dr. Rhonda Savage, and we're going to be talking a little bit today about a cruise that Penwell is offering along with Miles Global. So, Dr. Savage, thanks for joining me. And
Thanks for having me, Kevin.
oh, sure, absolutely. Tell me a little bit about the cruise and just the basics and what you're looking forward to the most about it, maybe.
Kevin, we're really excited, Linda Miles and I are, about this cruise. It's going to be a team appreciation cruise. And team, we mean the doctor as well as our staff. And we find that anytime we get out of the practice and we grow together as a team, that we accomplish so much more. So the cruise itself is going to be on the systems of the practice. It will be a practice success workshop. And we'll focus for our lecture part, there will be 2 4-hour segments. So 2 mornings, 4 hours each, so that way you can write the cruise off. And it's going to be about those systems that really drive our practices, great scheduling and financial arrangements, as well as reducing broken appointments within the practice. And also about having more fun within our practice and reducing stress. And, anytime we can have more fun, appropriate fun, it does make a big difference in our practices. So it's 2 half days on the cruise itself in the mornings, and then the rest of the time is all about team bonding. So we'll be going out of Fort Lauderdale to Cozumel. It's March 22nd to the 26th of 2012, and we'll be on the Liberty of the Sea. It's a Caribbean. It's a Royal Caribbean. I'll get it yet. A Royal Caribbean cruise line, and it's the top of the line. It's the nicest cruise ship that's out there. So, and the fees are very reasonable, but they should book now before the rooms book up, because it's after that, then the fees obviously go up. So we've got a November 1st deadline for booking those rooms.
And that's going to be here before we know it, obviously. So.
Oh, yeah.
Well, talk a little bit about, obviously this is a great incentive for teams. What are some things that you all are encouraging doctors and teams to work together to maybe work toward going on this cruise together?
There are a number of different ways that we can set aside time and money as far as earning our way on this ship. And simply a new patient bonus. Let's talk about that for a minute, because most practices today are struggling not only to keep the ones they've got, but to get the ones they want. And new patients are the lifeblood of a practice, as is your recare and your reactivation department, to get those people back in that need to come back in. So the one motivation that you could have set in place is a new patient bonus. The team members out in the community should be your marketing tool, should be your marketing effort out in the community, bringing in those new people. So everywhere they go, they should be carrying business cards and invite. So you could consider a new patient bonus as far as setting aside some funds based on each new patient the office gets, and because those new patients are valuable. So that would be one bonus structure. Another bonus structure may be based on production and collections, very simply. So take your current goals, your current production and collection, and your adjusted production, and take them and average them together and divide by 2, so you're averaging them together, and then reset your daily goal $200 or $300 over what you were already doing. Make it a reasonable goal, and then consider setting aside a certain amount of that money to put into a trip kitty fund, and that helps the staff earn their way on the cruise. Now, any kind of a bonus structure, I believe you should be checking with your accountant to make sure that you're doing it correctly. But there are ways that you can bonus. In my office, we bonused on cosmetic whitening. So we set aside, for a certain number of cosmetic whitening procedures, we set aside a certain amount per month based on how much the staff were able to talk about cosmetic whitening and get patients to accept treatment. The reason that I did that was anytime we talk about cosmetic whitening, it helps make the patient more aware of their own teeth and what they like and don't like about their smile. One of our consultants, Dr. Stan Mikulski, always says to his female patients, or has the staff say, share with me what you like about your smile. And many women will then turn around and pick their smile apart and say exactly what they don't like, just like we pick apart our hair. If a guy says to us, "Ooh, I like your new haircut," those women will oftentimes say, "Yeah, but I don't like this, and don't like that." So we pick apart what we don't like rather than what we like. But anyway, these are some different structures you can have. And if you're interested in our motivational incentive bonus PDF, email me at rhonda@milesglobal.net, and I'll send you our motivational program so that you can earn your way on this cruise.
That's great. And is that the same email address if they want more information on the cruise overall?
Yes, that would be great. Or they can contact my staff, and they can go online also and look at the program at milesglobal.net. It will be on our website also.
Great. And it's March 22nd through the 26th, Royal Caribbean's Liberty of the Seas. And I know that, I've been on one of these cruises before. It's a great time, and there's a lot of free time on there as well, where, like you said, there's a lot of bonding opportunities, and that's a great thing. So
yeah, it'll be a lot of fun, and it's, there is nothing like getting away with your team. The more your team do know each other personally, the higher the level of respect within the office, and the better the communication.
That's great. Well, we're looking forward to seeing you there, and Penwell's glad to be a media sponsor of this. So, Dr. Savage, I thank you so much for your time this morning.
Thanks for having me, Kevin, and we want you on that cruise. You will not miss it. You'll really enjoy it, I should say. Thank you.
Thanks.